Hello, I'm Dr. Padmaja Lokireddy. I'm a hemato-oncologist and bone marrow transplant consultant at Apollo Hospitals, Jubilee Hills, Hyderabad. I want to tell you about patient care and what has happened. This is a scenario with falsely low platelet counts. It's called spurious thrombocytopenia. He is a gentleman, Mr. Harisch A Nadra. He has come to me in January 2016 with a very low platelet count. He has had some treatment in Sholapur. He had a platelet count of 18,000. He had a platelet transfusion and had some treatment. He was very much worried that they were not going up. So they came to Apollo. When he came, actually we repeated his blood counts. To our surprise, his counts were absolutely normal after the manual correction. So the machine is showing low counts because the platelets were clumping together. But when we did a blood film manual correction, the platelet count is completely normal. So we have not given any treatment for platelets. We continue to observe him for 3-4 days as he was very anxious. The whole family came along to see us because they're obviously worried. And following discharge, he kept on monitoring his blood counts on a monthly basis. His platelet count went normal. In June, when he checked his platelet counts, they fallen down to 28. At that time, he was in Haridwar. He has repeated his blood counts, sustaining again it is low. He was very much worried. He has consulted a local doctor who has given some treatment, and he was also suggested some Patanjali treatment, papaya leaf juice. But because he has had this episode in the past, he has come back to us for a review. And when we examined him, he has no symptoms of bleeding or bruising or any signs of low platelets. When we looked at his blood test, his counts were again normal at 1.5 lakhs. But his counts spuriously were told him as 28 or 40. The difference comes when some people can have a platelets clumping together, and we need to rectify it and give a corrected count. So some small laboratories may not have this facility. So whenever somebody have got a low platelets and they're not having any symptoms, do not blindly give platelet transfusions. Establish why they're having low platelets before you treating him. So I'll introduce Mr. Hari Prasad, and he'll talk about his own experiences in his own words.
मेरा नाम हरीश चंद्र गुरुनाथ पांचाल, बसवा कल्याण के रहने वाला हूँ। बीदर डिस्ट्रिक्ट कर्नाटक स्टेट के हूँ। मेरे को थोड़ा बुखार आ गया था। बुखार आने के बाद मेरे को सोलापुर के अंदर एडमिट किए थे। एडमिट करने वहाँ पर प्लेटलेट कम होने से मेरे को इधर बाद में हैदराबाद अश्विनी के हॉस्पिटल का मेरे को प्लेटलेट चढ़ाने के बाद प्लेटलेट और इंक्रीज़ नहीं हुआ तो वो डॉक्टर ने बोला हो तो आगे अपोलो को हैदराबाद चला जाओ बोलने के बाद हम हैदराबाद को चलाया गए। हैदराबाद के अंदर अपोलो हॉस्पिटल में अंदर एडमिट हो गए। मशीन के अंदर प्लेटलेट कम होता था, अच्छा मशीन के अंदर प्लेटलेट कर तो अच्छा इंक्रीज मालूम हो गया। इसके बारे में और मैं हरिद्वार गया था, पतंजलि गया था। पतंजलि जाकर फिर ने हैदराबाद को वहाँ पर ब्लड टेस्ट किया तो वहाँ पर और प्लेटलेट कम आ गया बोले। कम आने से और मेरे को और थोड़ा डर लगा और रिपीट ने मैंने इधर अपोलो हॉस्पिटल को आ गया, पद्माजी मैडम से मिलने को आकर यहाँ पर प्लेटलेट और फिर चेक करा प्लेटलेट कम क्यों होता है, किस लिए कम होता है, पहले खोज करना जरूरी है। प्लेटलेट ज़्यादा करने के लिए कोई दवा नहीं है, तो उसने मेरे को घबराहट बोल के मैडम क्लियर बोलने से मेरे को थोड़ा अच्छा मालूम हो गया। तो मैं और मेरा गाँव को मैं चले जाने वाला हूँ।